Hello, my name is Takashi Asakura, a resident of Saitama Medical University Hospital, Japan. I'm pleased to have the opportunity to making my presentation here. Today, I want to present about comparison of water-filled and air-charged catheter for use in pressure flow study for female patients. Aim of this study is to examine the agreement for the degree of detrusor contractility and BOO by comparing the data of pressure flow study using water-filled catheter system WFC and air-charged catheter system ACC. From the UDS database between 2017 and 2018, the female patient who underwent a pair of consecutive pressure flow study, WFC and ACC systems, were selected for this study. Detrusor contractility was examined with PIP1. Weak detrusor contractility was defined at PIP1 less than 30. BOO was evaluated with Solomon-Greenwell-Boone Index 1. BOO was defined at P det Qmax more than Qmax multiplied by 2.2 plus 5. The agreement of Qmax and P det Qmax between two catheter systems were assessed using the Bland and Altman analysis. Cohen's copper was used for the agreement of category of detrusor contractility and BOO between two catheter systems. 38 patients had pairs set for analysis. After the exclusion of 18 patients, 20 patients were selected for analysis. The mean age of these patients was 69.1 plus minus 10.4 years. The presenting lower urinary tract symptom of this patient was as shown in slide. Initial resting pressure of physical pressure, abdominal pressure, and detrusor pressure in our trial is shown in Table 1. Each data value was within normal range in some article. Applying the Bland and Altman method, the value of Qmax were similar. Mean differences was 0.3. However, the value of P det Qmax in the ACC systems were higher than that in the WFC. Mean differences was minus 1.1. There were wide 95% limits for agreement for differences in both Qmax minus 3.9 to 4.5 and P det Qmax minus 18.0 to 15.9 respectively. Cohen's copper for obstruction and detrusor contractility estimated using BOO index and BCI were 0.625 and 0.696 respectively. Agreement were 0.85 and 0.84. Some articles report the pressure of ACC was measured higher than WFC. Our study was in accordance with it, although this tendency tells us that the pressure measured with ACC doesn't have perfect compatibility with WFCs. The agreement of detrusor contractility and BOO evaluated by PIP1 and ST nomogram was 80%. Maybe this degree of agreement is clinically acceptable. ACC has many benefits as easy setting, no positioning for transducer, no flush to remove bubbles in the tube, expect to reduce cost, hygienic, and so on. The pressure flow study using ACC's system may be a possible alternative to that using WSC system if their data is high quality with care to avoid pitfalls and obey the rules strictly. This is a small-scale study, therefore a greater number of cases is needed to generalize this concept. Thank you for your cooperation.